Do not get influenced by messages that you receive on your phone offering tests for 1200 rupees, 70 tests and all. No. This morning only, I had a patient who came to me with two reports. One report done by a lab through message where his vitamin D was shown to be 8.2. Normal is between 30 and 100. And a proper lab, it came as 68. It is seen anyone has to ask a question to a doctor. 8 out of 10 times, it is not concerning a prescription, but a doubt one may have in his or her own mind about a health issue or something you heard. Well, for all such doubts, all such queries, we are here at Dr. Saab, Hindi on Wednesdays and English on Fridays. Do subscribe and share our podcast to your contacts and friends. Hi, listeners. Many of you have sent queries with their specific ages, asking for what checkup they should do to find out about potential ailments. So, we thought instead of replying separately, we'll conduct an episode on preventive health checkups. I introduce you to our anchor for today, Preeti Desai, who will be putting your questions to me for answering. Thank you.
So, we usually get a blood test done when we are sick. But what is this concept of preventive checkup?
Preeti, I am sure you read about death of a celebrity singer few months back during a performance. I am sure all our listeners, however young they may be, have heard instances of somebody who just suddenly died, didn't get up in the morning. And people say, "Oh, I was with him last night. We had dinner together. We had a drink together. He didn't get up in the morning." So, in medicine, we have a concept of silent killers, ailments that lurk inside you like a terrorist and suddenly come up with a very major issue. They explode like a major issue. Acute condition, you get fever, you get diarrhea, you get body pain, and you go to the doctor. These silent conditions, we have to always find out whether we have them or not. The few silent ailments which I will tell you, which according to me come under the umbrella of silent killers. A person, 42-year-old, sitting in the meeting in the office, listening to a presentation, just collapses, reaches hospital in 10 minutes, dead on arrival. Postmortem says massive heart attack. He didn't know anything, but he was a smoker. Half the patients who reach a hospital with a heart attack have blood sugar above 400 and they didn't know they have diabetes. So, one is you do not know. Secondly, even if you know diabetes, blood pressure, cholesterol problem, they have no symptoms. They do not give any complaints. So, all those people having all these problems think, "I'm okay, I'm normal, I have no complaints. Why should I bother?" That is precisely the reason that you have to do preventive checkups. The concept of preventive checkups began with insurance. In United States, it started that, when the insurers started refusing policies because you have diabetes, you have blood pressure, you have high cholesterol, then people started checking periodically. And that concept has come to India. Of course, it has been taken in a new dimension, which I'll tell you subsequently. That is the reason that we have to do preventive checkups to find out what is our health status today and what are the chances of me getting a diabetes, a blood pressure, a cholesterol problem, or if I have one of these, getting a heart attack, stroke, or kidney disease. Dear listeners, we at Dr. Saab sincerely hope that you are benefiting from our podcasts, the tips that we are giving you. And let me tell you that although our English episodes have begun just a month back, we have been having Hindi Dr. Saab podcast for over 6 months. If you have friends, relatives who would like to listen to our podcast in Hindi, the link is available in the description. Kindly listen to it and share our podcast with your friends and family. Thank you.
So, who should get these preventive health checkups done?
Here I must tell you that human aging actually begins at 35. So I would say from 40 onwards, you should start looking at your health or at least talk to your doctor, asking him what to do. Please get only rational tests done. Do not get influenced by messages that you receive on your phone offering tests for 1200 rupees, 70 tests and all. No. This morning only, I had a patient who came to me with two reports. One report done by a lab through message where his vitamin D was shown to be 8.2. Normal is between 30 and 100. And a proper lab, it came as 68. So all these labs which are wanting your business, please stay away. Ask your doctor. Then people who are more at risk, like I am 40-year-old, but both my parents have diabetes. I am 40-year-old. I am overweight. I am 40-year-old. I don't have family history, but I smoke. So people based on their risk profiles should start checkups in consultation with the doctor. But I would say at 40, at least one cholesterol, lipid profile, one blood sugar, one kidney function, one liver function should be done. You need not do the entire panel, just one test, which your doctor can tell you. Doesn't cost too much money. That is required.
Sir, I'm 34 years old and my husband is 42. So, sir, what comprehensive health package we should go for? And what does this package cover?
So that's a good question, and I will give example. Now, are you overweight?
No, sir.
No. Do you have family history of diabetes or blood pressure?
No, sir.
No. So you should wait till you cross 40 and then you start your test. Does your husband have family history of diabetes?
Yes, he has.
One parent, both parents?
Both the parents.
So now, dear listeners, please note this. If both parents have diabetes, the child has 67% chances of getting diabetes. Is your husband overweight?
No, he isn't.
He's not. So he should do a checkup. Now I will tell you, he should do a package, comprehensive package, which will have a complete blood count, which will tell him about his hemoglobin levels, etc. He should do a fasting blood sugar. He should do a post-lunch blood sugar. He should do a test called HbA1c, glycosylated hemoglobin, which gives an average of previous 3 months blood sugar. He should do a lipid profile. He should do uric acid. He should do creatinine. Creatinine is the most sensitive test for kidney function. He should do one SGPT, which is the most sensitive test for liver function. How much alcohol does he consume? He doesn't. So if he was consuming alcohol regularly, I will tell him to check GGTP, which is a special test. G for Goa, G for Goa, T for train, P for Pune, which tells you about alcoholic damage to the liver. Then he should do a ECG, even though he has no chest complaints. This is a baseline study. Should do a urine test, and he should do a medical examination by a doctor, including a blood pressure test. Now suppose in this report he is found to be a diabetic. Then in addition we will say do a chest x-ray and visit an eye specialist because diabetes affects the eyes and should get checked from the diabetes perspective, not just the number of the eyes. Are you clear?
Yes, sir, very clear. Thank you, sir. So this we understood for a regular checkup. But are there any checkups for specific diseases like cancers?
Yes, these checkups are for silent killers. There are cancer checkups for common cancers. There are certain blood tests which we do to get an idea about potential of cancer. So let me take women first. Commonest cancers in women are breast cancer, ovarian cancer, and cervical cancer. For this, a woman, if she has a family history, if her mother, sister, or aunt has had breast cancer, maternal aunt, then she should start at 35 a sonography of the breasts to be done every 1 year till age 45. Then she does a mammography. If there is a suspicious lesion, if she feels that there is a lump on feeling, then she should start this sooner. Then for cancer of the ovary, there is ultrasound of the abdomen and pelvis, which should be done every year. And for cervical cancer, it is a test called pap smear. There is no age for pap smear. Ideally, every sexually active woman should be getting pap smear done every year. More important if there are multiple partners. If there is no history, then sonomammography at 35, pelvic ultrasound from 40 onwards, and pap smear once a year should be done. If there's a family history, then as I told you, things become more critical. The commonest cancer in males is prostate cancer, for which we do a blood test called PSA, prostate specific antigen, which should be started from the age of 50. But nowadays in corporate health checkups, they are doing it much earlier. Then, if there is a history of ovarian cancer in mother, maternal aunt, or sister, then we do a test called CA125, cancer antigen 125, which, if raised, gives a suspicion of cervical cancer, and other tests can be done again.
So, sir, lastly, people who are diabetic, what tests they should undergo?
See, diabetes today is one of the most scary diseases because that blood sugar level by itself does not kill anyone. Diabetes causes problems in the brain, giving stroke, in the eyes, giving retinopathy and irreversible blindness, in the heart attack, in the kidney, chronic kidney disease requiring dialysis. So, a diabetic should once a year do a full package to make sure that all these organs are functioning well. Then, every 3 months, they should do glycosylated hemoglobin to make sure that their diabetes levels are normal. Some people say, I have 250 fasting sugar, and for me, that is normal. Dear friend, you cannot have a normal for yourself. The normal sugar is 100. And although we are talking of preventive checks, I must tell you one thing. All the checkup that you do should be discussed with your doctor, not filed away for future. And secondly, when it comes to blood pressure or diabetes, there is no borderline. You are either non-diabetic, pre-diabetic or diabetic. You have normal pressure, you are pre-hypertensive or hypertensive. That word borderline gives you a false sense of security and you tend to ignore your health. Please talk to your doctor. Look at your risk profile. Risk profile is obesity, 1, smoking, 2, too much consumption of alcohol, 3, family history of hypertension, 4, family history of diabetes, 5. And most important, if your father or elder brother has suffered a heart attack or stroke under the age of 50, or if your mother or elder sister has suffered a heart attack or stroke before 55, that is a risk factor for you. You should start your preventive checkups much earlier. I am sure, Preeti, we have given enough tips for people to look after their health.
Yes, sir. Thank you, sir.
So, friends, follow us on our podcasts to get information about future episodes and circulate among your friends. Also, come back to us if you have a query about anything that we have covered or we have not covered so far. Thank you.